A very warm welcome to this video. My name is Dr. Saeed Kazmi. You're watching my YouTube channel, and today I'm going to present the latest updates regarding COVID-19 in UK. So finally, some good news for you guys. Number one, that as of today, the 12th of April 2021, so the government has lifted the lockdown. So there has been a partial lift of the lockdown now, and people can go out. The shops are open now. People can meet outside. And hopefully in a month's time, the lockdown would be completely lifted, though some of the measures like social distancing, compulsory mask wearing in the public transport, that would still remain. So the thing is that gradually the cases are coming down. In the last 2 days, we have seen that the cases being recorded daily are hovering between 1,000 and 2,000 per day. Similarly, the numbers of deaths have come down. Like, a couple of months ago, we were recording around 1,000 deaths per day. Now, for the last few days, the deaths are constantly below 50 per day. I think in the last 2 days, we had 7 and 13 deaths respectively, which were noted in the 24-hour time period. So that is good news. So overall, 1,000 to 2,000 cases per day, and the number of deaths have come down, which simply means that the R0, that is the basic reproductive rate for this virus, is hovering between 0.5 to 0.7. Though in some places it might be as high as 0.8, but in most of the UK it's down. And as I told you earlier, it is hovering between 0.5 and 0.7. Now, at this point in time, there are 47,000 symptomatic cases in the whole of United Kingdom, and which simply means that if you ask what is your risk, so the risk of randomly bumping into any one of them is 1 over 1,400. It simply means, like, if I try to explain it in very simple words, if you are going out again and again, and if you go out for 1,400 times, then probably one in that 1,400 you can come across a person who might be symptomatic, and obviously then there is a risk of transmission. So at this point in time, your individual risk of 1 over 1,400 randomly bumping into any one of them is quite low. Obviously, this also varies by the geographical area, but nevertheless, overall risk is low at this point in time. Now, as far as the government measures are concerned, the government is considering lateral flow devices for the general public as well. And lateral flow devices are those things which we as key workers have been using. So this is a self-test kit. So you just like take a nasal swab, and there's a cassette, and you put it in that, and just like a pregnancy test, it gives you results within 15 minutes. So you can either get a positive result or either you can get a negative result. Now, there have been a few apprehensions about these lateral flow devices, and just like any other diagnostic test, there are some issues regarding sensitivity and specificity. So in other words, there are issues regarding false positive and false negative. So with the overall rates coming down, once the public starts using lateral flow devices, if you get a positive test, so there is no point in freaking about a positive test, obviously, because there can be false positive as well. So if you are asymptomatic and you get a false positive, the best thing would be to repeat that lateral flow. So if you got two positives consecutively, then obviously you need to take some medical advice. But if you are unwell and you are symptomatic and you do a lateral flow test and comes out positive, then obviously you have to seek medical advice accordingly. Now, as far as vaccination is concerned, vaccination targets are also being fulfilled. I think at this point in time, only Israel is ahead of UK as far as the public vaccination is concerned. As of today, 48.2% of the UK general public has been vaccinated with the first dose. So you can say roughly around 34 million people have got the first dose of COVID vaccine, while around 11%, which translated around to 7 million people, have also got the second dose of COVID vaccine. So if you look at the graphs, you would see that only Israel is ahead of UK as far as public vaccination is concerned, but then UK is far ahead as compared to the rest of the European countries like Belgium, France, Germany, which are a bit lagging behind as far as public or mass vaccination is concerned. So I think we are moving towards the herd immunity. The other thing are some people are worried about the side effects of the vaccine, especially about the AstraZeneca Oxford vaccine. Now, it has been extensively studied, and they found out that the incidence of a serious side effect is 1 in 600,000, which is quite low. So you have to vaccinate 600,000 people to get one serious adverse effect, which is quite low when you take the overall incidence of the side effects. Obviously, there are a few minor side effects which people are more worried about, and we have seen that the minor side effects, which include soreness at the site of injection, that includes headache, myalgias, body ache, feeling a bit rubbish. So they are more common. Those, there have been two types of vaccines which have been given to the public: the Pfizer BioNTech vaccine and the Oxford AstraZeneca vaccine. So we have seen that those people who have been given AstraZeneca or University of Oxford vaccine, the minor side effects are more common after the first dose. So feeling pain at the site of injection, feeling rubbish, myalgias, body aches, headache, they are more common after the first dose. While in case of Pfizer and BioNTech vaccine, these side effects have been more common after the second dose. But nevertheless, there is no point in freaking about the side effects. These are minor side effects, and you get it in any type of vaccination. So these have been a few good news that has come around in the last couple of days. And again, to summarize it, the number of cases are going down. The mortality is also going down. Vaccination is picking up almost, as I told you. We have vaccinated 50% of the population with the first dose, and even the second dose is now picking up. And with that, there are plans for lateral flow devices for the public, so they can do testing and they can self-isolate or seek medical care, which would further cut down the number of cases. So if you keep all this scenario in mind, I think the chances of a third wave in the summer, as the lockdown would be completely lifted in a month's time, is extremely rare. So the chances of having a third wave, which the public and some people in the power circles are worried about, most probably that's not going to be the case if we believe on the numbers and if we look at the statistics. So hopefully you have understood what's going on at the moment regarding the COVID-19. Thank you very much for watching this video, and if you like it, give me a thumbs up. And if you're watching my videos for the very first time, please do subscribe to my channel. It really helps. And if you've got any question or queries, put it down in the comment section below, and I will try to answer it as soon as possible. So have a good day. Take care, and bye-bye.